Hello, my name is Stacia Street. I'm one of the second shift central pharmacy managers, and I would like to show you a quick video on a couple of different order types when you're verifying medications, and maybe a couple little tricks too that might come up and how to work around them. So we will start with our test patient. We're working out of a test SCM version, but it's pretty close to the realistic thing. So if anything comes up that looks odd, I'll let you know. But our test patient is going to be Adam Test, and we have a couple orders in here. We're in the work list, the MM work list, and we are going to start by verifying a methylpred for him. Let's see if we can find it. And just remembering that there are two systems actually in what we use as pharmacists. There's SRX and SCM. So currently we're in the SRX side of it. This is not a side that physicians or anybody else can see. It's just for us. So this is kind of our base, is what's known as the batch, where we can work from, and there are all kinds of filters you can build, but we're just going to keep it simple today. So starting with methylprednisolone. So this is an injectable that we want to do IV piggyback once for this patient. And when we go in to verify, we'll hit details. And one of the main things to remember when verifying orders is start from the top to the bottom and left to right. So there's certain orders sometimes that you have to fill in things, and the first thing you should always look at is your order type, because the order type can determine the different options that are available as you go, almost like a choose your own adventure. So we're going to choose our own adventure at the top. So this is a lot of things to pay attention to here, the dispense subtypes or the order type. You've probably seen materials that you've read about this, and this kind of puts it into perspective. But of all of these things, there are only a handful, maybe 4 or 5 that you'll use regularly, and that's what we're going to go through today. So, and sometimes products can be verified in multiple different ways. So with methylpred, that's an example of something that can be verified multiple different ways. So say we want to go ahead and add a fluid to this because it's going to be an IV piggyback. We'll go ahead and verify it as IV piggyback. That would be how you normally do it. Well, say I didn't want to make it piggyback because I know that this is a full vial and I want the nurse to take it out from the floor. I just don't want it added to a fluid. Well, I can't not add it to a fluid in IV piggyback. So in order to change that order type once you've selected it, you actually have to back out of the order, don't save your changes, and then go back into the order to re-verify it. That's really the only main way to change order type once you've selected it. There's a workaround that we'll see later when we get to metoprolol, but for now, we just need to exit out. So one of the second types, IV syringe, regular, is what you will use for certain things. And this one, when we go into the generic item, which again, working left to right, that's the first thing you pick in this row. This gives you multiple different selections. So dilutions are usually things that are used in pediatrics when the dose is so small that it's not measurable using one of the standard vial concentrations. Stock bag is a pediatrics thing that I'll go into and show again, but it's a standard stock concentration for injections to pediatric patients. Mostly for adults, you're only going to worry about non-dilution, non-stock bag items. So this one we see the dose is 125, the full vial is 125. This can be something that's given push. So this gives me the option to change it to cart fill regular. Now cart fill means that it's not something that's going to be manipulated in any way prior to dispensing. So it's not drawn up from a bulk bottle. It's not repackaged by the technicians in any way. There's no fluid added to it. It's something that can just be given as is by the nurse with very little changes. So that would be an example of this because it's something that we can push. So we would have the route BIV, and it should actually come from the PIXA station in this case. Most nurses can just get it from the PIXA station on the floor. So reading along here, this auto-perfected. So sometimes you'll have to go to generic item. You may or may not have to change the dose depending on if the concentration was, or if the dose was entered as a concentration or a milligram per mil sort of thing. It'll give you an error if you can't. This is all filled in, but these are fields that you might have to fill. Just looking over the order and verifying to make sure it's okay, you know, that everything makes sense. You want to look at the route, you want to look at the frequency here, PRN or not, if there's a start or stop date, those kinds of things, routine versus stat. And then moving down to the bottom, this is another field that's really important, and it kind of looks like a different language, but it's an important language to learn because it tells you where the dose is coming from. And as you get more experience with SCM, you're going to care about that, because ideally, if something can be given without any manipulation from pharmacy, you want it to just come from the Pyxis, because the nurse can give it right away. So this tells me that this item is not located in this location that this Pyxis is in, or in this patient. This patient is located in an area where this item is not in Pyxis. So it's going to be printing out to a MCC, which is Marquee, small label printer. And so that's the location. So this is going to go to a printer. Somebody's going to have to get it and dispense it just as the vial. So we would go ahead and save this to be dispensed in that manner. So that's an example of verifying to an IV syringe product. Now, say we want it to come, say it would have been in the Pyxis, but we want it to come from the IV room for some reason. We can still verify it to an IV syringe and not add a fluid to it. In that case, when we go into, sorry, right there, we would say, no, we don't want to change the subtype, and that leaves it as IV syringe. And again, it's going to go to the printer. Okay, so now that we've seen how to verify an IV syringe methylprednisolone, we're going to move on to really quickly, like I mentioned, a pediatric order and see the different variations that you have in there for verifying. So with pediatrics, they use syringe pumps. They have special concentrations for giving things to pediatric patients. So there are two different options. If we look at this Lasix order, Lasix, when we go in, there's not a stock concentration, but oftentimes the dose will be so small that it's not measurable. Now this dose is measurable, but say it was 0.04 mils. That's going to be such a tiny amount that some pediatric medications have the option for standard dilutions for the hospital. And so in this case, we do want it to switch to IV syringe, and it's going to be dispensed instead of from the Pyxis to a printer, and somebody's going to draw that up as the dilution product. Now in this case, say this is an incorrect order, because this isn't a pediatric patient, this is a 35-year-old. So say we talk with the physician, we know that that order doesn't need to continue. What we can do is move from the work list into the SCM side. That's what I'm flipping through with the tabs. And we can organize by alphabet and go up to this order and discontinue it. Per this physician that we talked to, telephone order read back. Okay, and then enter our password. And that order is discontinued. All right, so going back to the work list, let's say that we did want to verify a pediatric order on a patient. Maybe this was appropriate for some reason. Another type that we have, when we verify pediatrics, the first thing we should try is IV syringe, because that lets us know if there is a stock concentration, a standard concentration for administration for patients. So the stock bag would be this. If it were greater than 60 mils and not feasible to put into a syringe, we would want to go ahead and make this same concentration. At most, we could make it more dilute if we needed to, but going back, exiting out of the order, making it an IV piggyback instead of an IV syringe, and adding a fluid to it, which we'll go into IV piggybacks in a moment. But our next subtype that we're actually going to transition to is to a drip. So this one's a little complicated because you have to build, and another way, I'm right-clicking and going into verify, but you can also double-click on an order to go directly into the verification screen. It's just your own personal preference. Sometimes you learn things some way and you stick with it for a while. So in this one, we've seen cart fill, we've seen IV piggyback a little bit, we've seen a little bit of IV syringe. So what about something that's continuous or a drip? So you have these two options. There are different reasons that you'd use either of these, but for a drip, for example, this hydromorphone drip, we would go into it and we have to, again, top to bottom, left to right, you have to pick a stock product. Sometimes it's good at this point to communicate with the IV room and see what we normally verify to. Sometimes that can make a difference in the volume, and you can help prevent an error if you pick the wrong thing, if you pick the right thing, it could make a difference on the label, and it's best to just communicate first and see what the standard is. But in this one, we have to choose a concentration. We can give you some more pointers on that, but basically a lot of times we're doing a 10 milligram and 100 mil bag in these kinds of situations. So it's going to default to nothing because there's not a standard concentration for this. So I'm going to go ahead and make a concentration, go into 10 milligrams, and this is the fluid that's added. And then we have to change that to 100 mils total. And then we want to go into the notes and fill in the concentration since it's not standard. And then go back over to the order tab. And so looking over the rest of the order, it's IV. It's a hang time of 24 hours because it's a drip. It could have variable rates depending on what it is and what the rules are for the floor and titration. And then again, it's going to go to a printer instead of something out of the Pyxis because obviously you can't make a drip from the Pyxis. So we would go ahead and save that and verify the order. And on this case, we're getting some duplicate medication alerts. So these alerts require acknowledgement. You have the option to free type in, your rationale for the acknowledgement if you discussed with a team, or if you know that this patient has tolerated certain things before with an allergy. Those kinds of things would be appropriate to put in here. In this case, I would go back and check and make sure that none of these are actual therapeutic duplications. Sometimes they're PRN medications or discontinued medications, so I'd want to go back and look at the profile. But we're going to proceed in this case and verify the order out, and it'll disappear from the queue. So say instead of a drip, we wanted a hydromorphone injection, just a PRN thing for people who have pain every now and then that is pretty severe. So again, we would go into this order and verify it slightly differently. So this is coming up as cart fill. Again, it's something that doesn't require manipulation. So this is something that we want to just be drawn directly from the Pyxis. However, when we go down here and look where the location is, this isn't right because this is showing that it's going to a unit dose. That's what UD is, small printer. And we don't want that because that means somebody's going to have to pick it out of the Pyxis in Central, deliver it up to the floor, have a nurse sign for it, and this person's in pain, so they might want to dose now. So let's go up to our generic item. Even this is already pre-perfected. You have the option to change these when you click on the little dots. Anytime you hover over something that has dots, it means it's a changeable field. So we have all of these options, and sometimes it just requires some trial and error. So if you wanted to start from the top and go to the bottom, basically what you're looking for is for it to go to a Pyxis. And again, if you ever have questions about any of this, please call Central, and or any pharmacists around you, and they can help you out with this. But we always are there and looking for calls, so we're gonna kind of jump around in here. And sometimes if nothing comes up, you may have to select a dispense product to just check and see if it's going to be in a Pyxis. Nope. Nope. Not that one. This is probably why you should go in order.
Oh, check the floor stock.
Okay, so this one, the floor stock wasn't checked. Thank you, Gavin. So that usually doesn't come up. That's an odd little error that came up. But in that one, we want to make sure floor stock is checked because that's what we want them to do. And so then we see that it does not perfect to a printer. It goes to a location. This is very typical for a Pyxis name. So again, just ask somebody if you're not sure. But Pyxis names usually have the location involved somewhere in the name and then a bunch of other letters and numbers. So finally, we found the correct product and we can get this person their pain med. Oh no, another duplicate medication therapy alert. All right, so now he's got his pain medications, but maybe his blood pressure's a little up. So he's gonna get a little bit of metoprolol. And again, be sure that, everything matches with the patient. Occasionally there are errors, but you wanna make sure that what you're seeing in here matches here, and we're checking allergies and height and weight and everything to make sure that that's good, because it's not just about clicking a button, it's about looking at the whole patient. So in this case, we do allow nurses at this time, that may change in the future, but to half tablets, but quartering tablets is a little bit tricky. Sometimes things fall apart and it's not always accurate. So anything that's quartered, so this is a quarter of a tablet, we want to go ahead and make in central. So this auto defaults to an oral special. If we look in here to see if there's a smaller tablet, maybe we can have them half it on the floor. Nope, there's nothing. So we're going to have to go with just the smallest tablet, and it's going to be quartered. And so the one thing to look out for is make sure that this doesn't come as a cart fill, because it's not something we don't want manipulated. It's something we do want manipulated by a person before it's dispensed. So that's going to be an oral special product that prints out at the unit dose printer. A technician will grab it, take it over to a table, cut it into quarters, and then have a pharmacist look at it and send it up to the floor. If we want to see ever what a label is going to look like, label options is another thing that we can just take a peek at here. This will show you actually what's going to print out on that printer for that technician to see, and also the number of labels at that time. So for oral specials, it's slightly different than a cart fill, or than a cart fill item. And cart fill can mean from Pyxis, or it can also mean from Central, like they pull it. It's just, it's not a location necessarily, it's a handling of the item that you're choosing. So on this one, because it's oral special, an additional baggie label is going to print out. So there's going to be a dose label here that's going to be scannable, and it's going to go on the outside of a little plastic bag that the quartered tablet is kept in. And then that's going to be placed in a separate outer bag that could have multiple of those prepackaged little doses in it. So we like how this looks, and we are going to verify it. So another metoprolol order, what's going on here? It looks like Adam has an additional metoprolol order. So let's say maybe they made a mistake, they don't want the 6.25, we would go ahead and discontinue that. They meant to order a whole tablet and not a quarter tablet for him. So in this case, this is an auto-perfecting order. This is one of the easiest order types, but it doesn't mean you can just go ahead and click. We still want to check and make sure everything makes sense. So a cart fill, it's a tablet, it's a whole tablet, that's fine. Something to look out for is dosage forms and whether it's possible. So maybe if you have a capsule here and it's asking for half of a capsule, that doesn't make sense. So just because it auto-perfects doesn't mean that it's correct. You still have to go through and use your judgment and common sense to make sure that this is a dispensable, deliverable item. So in this one, it's not going to a printer, it's going to a Pyxis. That's awesome. Let's say somebody had entered it as the 50 milligram. That's probably going to be in the Pyxis too. Basically, I'm just kind of going through this to show you that you have the option to choose different products, and sometimes they may or may not be in the Pyxis. It's not always going to auto-perfect to something that's in the Pyxis, but since that's our goal, sometimes don't be afraid to play around in here and look at what sort of generic items you have and what different options it gives you. Now, say we, for some reason, wanted this to be packaged specially, maybe, I can't really think of a scenario, but if there was some reason that you wanted this to go to the pharmacy and be dispensed from Central, maybe you wanted somebody to look at it first or something like that, you can, maybe we wanted them to only get brand name and we didn't want them to get a generic, and we wanted a pharmacist to look at that each time. Well, in that case, we would want to uncheck floor stock, and it's going to go to a printer, and we could type in a special little note to have somebody take a special look at it. We also have the option to make it an oral special so that it's packaged as a special dose. So that changes that order type. So this is that back way that I was kind of describing earlier. Again, this isn't something necessarily that you need to master now, but it's something to keep in the back of your mind that there are a lot of different little tricks in here, and if you ever can't get something to do what you want, just ask somebody and they might know the right way to do it. But we're just going to go back and make it normal again. Change it back to cart fill, yes. And then it's going to go back to the Pyxis and auto recheck all of that. So I can verify that out. And like I said, not all cart fill things are necessarily in Pyxis. Not all cart fill items are necessarily oral medications either. So let's say that we have this Zosyn order, so he needs some antibiotics as well. So this item is going to come from the Pyxis, but it's still going to be piggyback. So I guess the main thing that I'm trying to point out here is that order type doesn't necessarily signify a certain way that something's going to come. So you want to always make sure that your order type is right, but also that your location that it's being dispensed from is right. So we keep a lot of mini bag plus items in the Pyxis. This is going to a Pyxis, but say we wanted the IV room to draw it up and put it in a special fluid, because mini bag pluses are built with this note in here that it's for the nurse to dilute it with normal saline, 100 mils. If we wanted it to be in D5 maybe, we would have to change that to just the regular vial. So this is the 4.5 gram mini bag plus, but there's also a 4.5 gram vial. So in this case, we would go ahead and pick that and add a fluid to it. So if you type in NS, it brings you up all the options for NS. In this case, we just want a simple 100 ml bag. And then it auto perfects, but again, you want to go ahead and check all of these down here. Is the hang time 30 minutes? That sounds reasonable. It's coming to a printer instead of to the Pyxis. All of that makes sense. But say somebody made the mistake of picking the mini bag plus. So what happens here? You have mini bag plus and then 100 mils. So if that's running at 30 minutes, that should run at 200 mils an hour, right? Except it's 400 mils an hour. That's because the mini bag plus, the computer auto calculates that 100 mils in for that mini bag plus item, so it thinks that this is 200 mils, and that results in a doubling of the rate. And that can be a problem with certain drugs, so we want to make sure that we understand what we're selecting and here what our different options are. So in this case, sometimes we get a little freeze there, we just have to wait. Say, oops, I didn't want this to be NS, I want it to be D5. So before you verify it, you can still alter the fluids a little bit, make some changes. So just being sure that everything is right before you save your order and verify it. So we like everything that's in here. Oh no, they have an allergy. Well, we can't verify this. We're gonna have to talk to the physician. So we'll go back out of here and put a note on it. So how do we do a note? A note says to everybody who's looking at this order from this view, if we right click it, attach an RX note, and it's something that people can add to, they can read, and it'll say paging physician about allergy. So if I save that, this puts this little note in this notifications column. So say somebody else is looking through here and they see this, they can click on it and see that this is me, ZZ Farm, is paging the physician about an allergy at this time. So say it had been an hour and I wanted to get back about how the physician's in the OR and they're not calling me back yet. So I could add to this and say, still waiting. Still waiting for MD. So I can update everyone so that they know I haven't just forgotten about it. And that's an important function that allows you to communicate to multiple pharmacists at a time, because again, this is only our view, but it is helpful, you know, when people are working on orders, so that we know that it's just not that nobody has looked at that order, it's that they're working on it currently. So that's a good process to get into the habit of communicating with people in that way. So the last thing that we want to look at, or sorry, second to last thing we want to look at is IV piggyback order type. So let's go to vancomycin. So we go in here. So this is a piggyback item that auto-perfects to this. What does this mean? Vancomycin 1 gram, 200 ml solution. Interesting. So this auto-perfects. We want this to go a gram an hour. What are our other options that we have in here? So for vancomycin, we have quite a few different things. Anytime that you see something with a gram and a mil added to it, it means that it's a pre-mixed item or it's a preset, kind of pre-built thing. These are all our standard concentrations of vancomycin that we use. You can certainly build your own by doing a gram and then adding a fluid, or using the bulk vial and adding a fluid if you need a, not one of our standardized doses. But anytime you pick one of these items that already have a fluid in it, just like with the Mini Bag Plus, do not add a fluid to this item. If you want a different fluid, you pick the vial and then you can work from there. But adding a fluid to something that already has a fluid is just going to cause a problem in your rates and confusion with the label and that kind of a thing. So in this one, for most of the patients, unless they're in a certain location, we're going to want to use this 1 gram standard premix that we have. So again, this is going to go to a printer and be pulled and dispensed on the floor, and it's a stat med, so we're going to go ahead and send that. Okay, so we've gone through so far 5 of the order types that are the most common of that long list of order types. IV syringe, which was that methylpred, and that Lasix, and the cefepime. A drip, which was the hydromorphone drip, and then an injection, which was the cart fill example, something coming from the Pyxis, and then the metoprolol also that was just a cart fill. Then we had the quartered metoprolol under oral specials. And then we had IV piggyback was the vancomycin, or also the Zosyn if you're not choosing the Mini Bag Plus item. The last thing that we wanted to look at is a non-formulary example. So non-formularies can be identified by this little NF that comes up in the order notification column. So this one is a free text sort of option that the physicians have to enter a name. So it may or may not be accurate. In this case, they're trying to order Vinilex, which is an ointment that we use for wound care. It's a very common order that you will see. Hopefully, by the time that you're looking at this, it won't be non-formulary anymore because we don't really have any other options. But in this one, you have, again, the different order types that you can pick. This is a little tricky, and probably we're going to have to do the most sort of exploring with your options because all of these can lead to different configurations within your choices for the generic item. It can change drastically. So this is, again, a good time to maybe grab somebody if you're unsure of what you're doing who has been a little more experienced with this to kind of help you out. But we're going to say this is a multi-dose item because it's a tube of ointment that we're going to use over and over and over again on the floor. That's as opposed to a regular item, a regular non-formulary item that might be just a dose that we dispense that's non-formulary. So we're going to go to cart fill because we don't necessarily want to do anything different to that tube before it leaves or before it's dispensed to the patient. And so once we click here, it's going to give us a list of all the different things that have been selected as non-formulary before and that IT has built a code and a charge information for. So I know that Vinilex is this Balsam Peru castor oil topical ointment. So I can go ahead and select this. The dose is 1 application. Sometimes where you might run into problems is if somebody had put 1 gram. That probably is going to give you a problem when you verify it, just knowing that you have these different options. But say Vinilex was not this, and we can't find this in our list. The next place we would go down to is to the bottom, and there's always going to be an unlisted drug option. So in that case, we would want to pick unlisted drug. So we go here, we try to save it. Oh, data is null. What does this mean? This means that you picked unlisted drug, you can't use a unit of measurement because unlisted drug is just a very generic term. So you always have to do 1 each because now you get to free type your instructions onto this. Because say we verified this, if we look at our label, this is what the technician is going to see. And so that doesn't tell them anything about the drug. It doesn't tell them anything. So what we would have to do for that is go in here and enter a note, and usually special instructions is a good one to use for that, and enter Vinilex, ointment, usually generic is the best, but any sort of special instructions you want, you're basically building your label here, so you can make it look like whatever you want. Apply to affected areas BID. So let's say I want to double check how that looks and see if I want to do any different formatting ideas. We would go back and look at the label options. And so this at least gives me a drug name. Sometimes, like I said, you can do a little bit of formatting to make it slightly prettier, that kind of thing. You can add a space in here if you want that to read a little more clearly, but just going back and forth between these two tabs until you get it to how you want it to look, that's how you do that. But in this case, like I said, we have it already pre-built because this is a very commonly ordered item. We want to go back and make sure the dose is one application. Select this, delete our note out of there, because we don't need that anymore. And then everything else is checked out, so we can go ahead and verify that order. So there are lots of tips and tricks. I could go on for days about this, but this kind of gets you the basics about the different order types. Depending on what areas you work in, you might use some of the other ones. And again, that's where you might ask a more experienced person for demonstration on how to use these and how to best go through it. But this is a basic about IV syringe, drips, cart fills, oral specials, IV piggybacks, and non-formulary items. So thank you again for your attention, and if you have any questions, feel free to call anybody at this hospital. We're all pretty friendly, and we would love to help you. Thank you.